So one thing which I've noticed is that our children look forward to coming to you, patients who are young, and that is why, because it's very challenging to make a child sit on the chair and to make them open the mouth and
So I created magic as a way to connect with these children, right?
you want to speak a little about nitrous oxide and the safety of it.
Right. So a bottle is anyway should be weaned off. Breastfeeding is great.
I meet a lot of young parents now. So they always, the first question, a very routine question that they ask is that when should we get the child to the dentist? And I'm like, at last that, if it's such a struggle, why don't you just give a pacifier?
Yeah. The only known substance till now that actually prevents cavity.
Hello everyone. Welcome to Confessions of a Dentist, episode 2, where we talk about truth behind the smiles. In today's episode, we would be talking about our tiniest patients, their journey from birth to school to the early wonderful teen years. And joining me is a magician in his own right, Dr. Nikhil Grover. Welcome, Dr. Nikhil. Dr. Nikhil is our exclusive pedodontist who has been in practice since the past 20 years, who makes child dentistry look like a piece of cake. So over to you, Dr. Nikhil, and so happy to have you.
Thank you so much, Ishita. It's such a pleasure to be here. So, pediatric care or dental care for children has always been on the back burner till they have pain. That's when the patients come to us. So we want to flip that in this podcast here and, bring them in early so that we can, treat them early, treat them young and catch them young so that we can provide the best care to those little tiny patients of ours.
Yes, definitely. And with the lot of exposure to parents these days on knowing about early intervention and even like trying to check for their health in early years, which was probably not there in the past. I also want to confess that as a dentist, we don't like to treat children so much. A majority of dentists do not like to treat patients who are young, and that is why, because it's very challenging to make a child sit on the chair and to make them open the mouth and let alone treat them. So were you always knowing that you want to be a periodontist, or how did you always want to become a periodontist?
Actually, it goes back to my mother is actually a special educator. So she deals with children with special needs since I was young. So I was impressioned by that. And so when I started doing dentistry, I realized pediatric dentistry was the only specialty that dealt with children, with special healthcare needs. So that's when I kind of developed an interest in pediatric dentistry extra. And because I was so interested, I got opportunities in my internship. And when I did my residency, they made me a default pediatric dentist. And I realized I have a connect with children. So then, that's how I kind of honed my skills further. And, unless you're passionate about it, you can't do it. So then that's when I decided to be an exclusive pediatric dentist.
Oh, that's great. And your mom runs an NGO.
She's part of an NGO.
Yes.
Here.
Because treating children is anyways challenging, and treating children with special needs is also a very challenging job. And you have specialized also in
Yes, I have
treating.
done a fellowship from Indian Society of Pediatric Dentistry. And, so I have trained in that. And, we work together. We've done so many camps and everything together.
Yes. Even
Through
for the
Smile India,
Smile India
yeah.
patients, you have like always helped in treating special
So that's
care
my
needs.
passion. That's how I started pediatric dentistry. And then, every child is special by the end of it. So, it's all encompassing.
So one thing which I've noticed is that our children look forward to coming to you, which is because everyone, even adult patients, they come and they say, "Humko dentist ke paas aana acha nahi lagta." But your like patients, they are like, "No, we want to go to Dr. Nikhil," and they get so many rewards. It's not a bribe. They get balloons and they get these. You do magic tricks which are so nice. So how did you come up with these fun ideas?
So actually, I've been doing this for a long time. So I earlier used to give balloons and small things like that. But actually, COVID is what inspired me, because I realized, wearing those overalls, connecting with kids became a little more difficult, considering, how we were all dressed. So that's when I kind of came across a couple of reels on the net, and then I kind of redeveloped myself. So I created magic as a way to connect with these children, right? And so initially, children come in very fearful. So when you do magic or break the ice with them, so it builds curiosity rather than fear. So they shift to they become less fearful and more curious. And suddenly, when they do magic and we kind of break the ice before they sit on the chair, they actually become so comfortable that they start, they start getting more excited and interested. And rather than think that they've come to a dentist, they're more curious about the magic and what we're going to do next. And suddenly, they feel more in control because the whole fear of dentistry is about losing control. So when we put the control in their hands, when we make them do magic, so they actually feel more in control. So that's how I kind of developed, and then it went from there, and then balloons and rewards and tattoos and the works.
Yes.
So
Yes,
it's
but
anything to build connect
yeah.
with children.
Even like generally as a dentist, we always have dressed up in scrubs and like those kind of in layman's term boring outfits, but you always put like some color to it, like even if it's with your
Yeah,
like
caps,
head
yeah.
caps, and also it's really interesting. Plus you have so much knowledge about like all these Marvel and all those cartoon characters that I think they connect with you so much because they're like, yeah, he's our friend and he knows what we are
Exactly. So it's
talking
more like
about.
continuing education for me. So that
Yeah.
every time I'm watching YouTube or something, it's part of my job. So I'm allowed
Yeah.
video games and all of that.
Yeah.
So so
Ev-
that's the best part about pediatric dentistry.
Yeah.
you
Even
always stay,
Huh.
you always stay young.
Yeah, even like the setup is like more comforting because even when we get like sometimes we treat our adult patients also in the pediatric chamber. So there are toys there, there's a TV, so the child can watch like whatever you always ask whenever the child comes. You're like, what do you want to watch while you're getting treated? Do you want to watch Peppa
Yeah.
Pig and all? So they're like, yeah, and they've decided that today I've come for my treatment and I will
Exactly.
get that done. So you made it really comfortable for the
That's the whole
patient.
thing. It's the experience. And now what I started doing now, and I mean, we've been doing it since a while now. When the parent contacts me initially, I usually give them a pre-appointment kind of a letter where I brief them on what we're going to do and also find out about the interests of the child. So what do they like, cartoons. So when they come in and they already see like their favorite Harry Potter on the screen,
Yeah.
immediately they're like, they're like, this person's actually interested in me. So
Yeah.
the kid feels special, and then
Yeah.
that's how we just take it from there. So
Yeah.
difficult treatment becomes easy. It's like
Yeah.
it's like a breeze after that.
Yeah. That's great because not a lot of people focus on like knowing because we've been taught always in dental school that we just need to know what treatment
Right,
to do.
right.
So nobody really teaches soft skills, and this what you're talking about is so much not only with the soft skill with the patient, but in especially in a specialty field like child dentistry, to get to the level and understanding to know so that the child also feels that you've taken keen interest in knowing the child, and the parents also feel that it sets you apart from another like
it's just that also when the child, I've always been taught this since I was in my college and where under my guidance of my HOD and everything. We are treating a person, we're not treating the teeth. So we have to treat the person as a whole. So unless you get to know the person, you can't really do dentistry. The teeth come in later. The person or the child comes first.
Yes.
So that's my philosophy always. Anything to bond with them first.
Yes.
Then treatment later.
Yes. A lot of times I get a lot very, very apprehensive patients who come and they are really bad oral health and it's completely neglect. It's nothing else. And whenever I try to trace it back that why did you
Right,
not
right.
come? So they're like, no, we're too scared. They always speak about one traumatic experience that they've had as a child because so much knowledge probably wasn't there. Like they talk about, oh, we ran away from the dentist, कि उन्होंने हाथ पकड़ लिए थे. What was there? Was a technique in our books called
Yeah.
something, right?
Yes.
In which you have to hold the child
Protective
down.
stabilization is what
Yeah,
we call it, yeah.
yeah. So I mean, obviously, if we also go through it as an adult or a child, even we will not have the best.
Absolutely. So that's totally a no for me now. I don't do that.
Yeah.
I mean, I never did. In college, maybe it was a part of a technique for children with special needs or something, but I
Yeah.
don't have the heart to do it anymore.
Yeah.
And we have so many better options.
Yes.
As we
Yes.
do, we have nitrous oxide, we have sedation.
So you spoke about nitrous oxide, and I think it's like a game changer.
Absolutely.
So you want to speak a little about nitrous oxide and the safety of it?
Right. So nitrous oxide has been around since many years. It's been in the US. It's been like a standard staple thing. In India, it's been around for 10-15 years now. Lots of people have been doing it, but it's like the safety has always been because it was a confusion between anesthetists to do it, not do it. A little controversial still, but it's 100% safe because we're always giving oxygen. So there's always 100% oxygen is what we start with, and at the highest nitrous oxide concentration also there's 30% oxygen, which if you're living in a city like Delhi, it's probably more oxygen than you're going to get on a normal day,
Yeah.
living here. So it's 100% safe, easily reversible. That's why it's the only thing that I do safely in a clinical setup. sedation and GA and more complicated things are reserved for a hospital setup, because child's priority is safety is always our priority.
Yeah.
Do to somebody else's child what you would do to your own, So
Yeah.
that's the basis of pediatric dentistry. So
Yeah.
if you won't do that to anybody or your own relative or your own kid,
Yeah.
you don't do that to anybody else either.
Yes.
So
that's
safety was
true.
always a thing, and nitrous oxide is 100% safe.
Yeah. Nitrous oxide also works with it's an inhalation sedation.
Right,
So
right.
it works with, like, there's a nasal hood which goes on the nose,
Right.
and then you just breathe through. So the whole mechanism works on breathing through your
Breathing.
lungs.
And it's very fast. Its turnover is really good, quick.
Yes.
It acts fast. It gets removed equally fast. So we can reverse it. It's very easy. But as a warning, if you mix it with other drugs like midazolam or other oral sedatives, then it gets a little tricky. So
Yes.
then you have to be more careful.
Yes.
So then you need to be ready for the next level.
Yes.
But plain nitrous oxide, which is what we are using at dental aesthetics, is completely safe.
Yes, a lot of times, we very routinely, we honestly had procured a nitrous oxide machine for pediatric work,
Right.
but we are using it, like I do sedation for adult
Absolutely,
apprehensive
yeah. We've
patients
had
for
such great
implants
experiences,
and
yeah,
surgery, like almost every second, third day. That because now, since that is available in the clinic and people are aware of it,
Right.
and we also speak about it, that if a patient
Give
comes,
that as
like,
an option, yeah, absolutely.
So and the only thing is that adults also have an issue with safety, which we keep telling them, but obviously with kids, parents are also
Even
very
more,
apprehensive with
yeah.
anything to do with sedation. So
It's also that it's becoming more mainstream, so it's more heard of, and many more people are doing it, so that
Yeah.
automatically becomes more like normalized. Like
Yes.
things that we earlier thought was abnormal as they become normalized. People have realized that there is nothing to really fear, and it's become more the norm rather than the exception.
Yes.
You know.
Are there any precautions that you speak about before the sedation or before and after the sedation?
Before, basically, there's a full checklist that we give the parent to inform. Obviously, they have to be, it's a parent for kids. They'll always be accompanied by somebody, and the nil per mouth is what we follow. So nothing to eat or drink 2 hours before, and preferably nothing heavy 4 hours before. That's what we take.
Okay.
Earlier pulse oximeter and all of that was required, but the current guidelines suggest it can be. You don't need to do it, but if I have a doubt about a child, then I keep it on depending. So, but the case selection is key.
Okay.
We don't use it for every child. So there are certain exceptions. So in those cases, we don't use it. So that history is very important.
Okay.
Always we take the parents. So once we get that, then the safety is, rest assured, nothing will go wrong.
Okay. Is there any, would you want to talk about in which cases we shouldn't use nitrous oxide?
Yeah, there's there's children who have had recent ear surgeries because of the pressure nitrous oxide builds in, plus with hemoglobinemia. That's another condition where it's contraindicated, as well as these are the main contraindications. People think that asthma and all of that would be a contraindication for nitrous oxide, but it isn't. It actually helps ease the anxiety, so it actually helps because you're always giving oxygen. So in those situations also it's permissible, even though, because asthma is very common in kids nowadays.
Yes.
So it's allowed for that also.
Got it.
So it's got very minimal contraindications. We just have to take care of the safety of the gas exiting the. We have to be more careful. Dentists who are exposed to it, to make sure it's out. It gets out of the operatory. So we have scavenging systems for that.
And with nitrous oxide, is there anything to do with pregnancy?
Yeah, it has a so-called teratogenic effect, as they say. So for pregnant women, it's best avoided. So that's why when my parents come in, when I'm treating a kid and the mother is pregnant with their second child, or that way, so I always tell them in advance that they cannot be in the operatory, because the nitrous oxide that's around can cause some kind of miscarriage. Or there are studies, but I mean, why take that risk, even the minutest risk?
Yes. I remember when I was pregnant, I was not doing
I remember
sedation.
that.
I was always.
So I got all the cases
Yeah.
for the adults also.
I was like, Dr. Nikhil, you have to do the adult sedation. I cannot enter the chamber.
Absolutely.
So, yeah, that's great. But that's a great knowledge that parents or patients would like to know. And what about the recovery from nitrous oxide?
Great question. Actually, a lot of parents ask that. So they are worried that what's going to happen. Will they have to wait, or will the child have to? Can he play? Can he do something afterwards? So the good thing about nitrous oxide is, because it gets reversed almost immediately, all we do is, after we're done with the procedure, we give 100% oxygen for about 3 to 4 minutes, and the child is as good as how he got in. So usually they're okay. We just check their pulse and the oxygen saturation to make sure everything's good. And usually they're playing within the next 2 minutes, and the parents, when they go home, there is no issue most of the time. So it's completely safe. And the best part is that you recover so fast. So it's like almost the way they walked in, and apart from the induction and all, maybe it takes 15-20 minutes extra.
Yeah.
But the procedure that we get done is so much more because of the child being so relaxed,
Yeah.
watching their television, looking at the screen, so they're so relaxed that we get to do so much more work
Yeah.
and that one appointment and
Yeah.
all the needle phobia. So there's a very interesting term when it comes to nitrous oxide. It's called time agnosia.
Oh.
Okay. So basically the advantage of nitrous, because kids have no very short attention span. So what tends to happen is they get very fidgety. With nitrous oxide, when they're lying down and that or nitrous oxide is working, they have no idea of time. So we also call it an amnestic effect of nitrous oxide. So they have no idea how long they've been. So once the nitrous oxide kicks in and it starts to work, if you work for 1 hour also, they think it's just started. Because that period is like they're not aware of the time.
Yeah.
So that is a big benefit of nitrous oxide. So we get a lot more work done.
Yeah.
They're just sitting, they're chilling, they're watching their TV, they're in their own zone. So we get to do so much more work which we wouldn't be able to do without nitrous oxide because of that time agnosia factor. So it kind of keeps them the amount of time that they're spending, they don't know. So that's a big advantage. And recovery is almost after that 100% oxygen.
Yes.
And they're back to normal before they leave.
Is there like a particular time that the nitrous oxide should be given to a child? Like you said, 1 hour. So is it that?
No, you can stretch it to 1.5 hours. Still, you have nitrous oxide. There's no limit as such.
Okay.
But we look out for signs, right? So when we see that they're going on a deeper plane, and this happens very commonly now. In fact, this Saturday when I was working on a child, so nowadays kids don't sleep on time and they come on Saturday.
Yeah.
So the parents say he didn't sleep well. So when they start taking nitrous, then they start dozing off a little,
Yes,
and then we get a little
Yeah.
perturbed that hopefully it's not because of nitrous going too much nitrous or whatever.
Yes.
So then I kind of abort that and tell them to come back on a day when they're more fresh.
Yeah.
So that's one tip that I've seen recently. With
Yeah.
kids,
Yeah.
because they don't sleep till 12, 1 at night, and then they come in the
Yeah.
morning for their dental appointment. So you don't know that nitrous is making them sleepy or
Yeah,
it's
or they're just
they're just being naughty
Yeah,
or
but
enjoying their weekend.
That has actually happened to adult patients also,
Yeah.
that they're passing out like sleeping, and
So
I'm like,
luckily-
no, you
luckily-
need lesser nitrous oxide at that time.
At that
yes.
time. So that we can titrate. That's the
Yes.
biggest advantage of nitrous oxide. It's titrable.
Yes.
So once you feel that it's too much,
Yes.
you just reduce the amount.
Yes.
So then
Yes.
you can get them back to normal. And anytime you feel it's out of control, 100% oxygen within 3 to 4 minutes, you're back to good.
Yes.
As good as how they walked in. So that's a huge
That's
advantage.
great. That's great. Also, a lot of, because I meet a lot of young parents now. So they always, the first question, a very routine question that they ask is that when should we get the child to the dentist? And I'm like, isn't your child like 3 or 4? They're like, yeah, our elder one is like 8. I'm like, have they never been to a dentist? Like they need to go. So for them, like, or for like, just because I used to think that it's a very easily like people would know this, a basic
Right.
thing, but people actually do not. So anything like tips that you want to share? When should they come to the dentist? When should they start brushing? All that, like we can tap into that.
Right. So, because of lack of awareness, people think that you only come in when there's pain or when the children are much older, they're too young to, be able to deal with it earlier. But the American Academy of Pediatric Dentistry and endorsed by our society in India also, the age 1 dental visit is critical. So that's the golden rule. So you come in at the age of 1, that's when you should have your first birthday, first dental visit. Or when the first tooth comes in within 6 months of that. So that's what we call the age 1 visit. Why come in? Because we actually create something called a dental home for your child. So when the child comes in younger and we just do an examination, usually we do that in a knee-to-knee position. So that way the child is also comfortable with the parent, and that's the only way we can get to, because parents are very worried, how will you examine their teeth, at such a small age, how will you open his mouth?
Yes.
So it is a little bit of a task, but we actually get it done really quickly.
Yes.
So we do it in a knee-to-knee where we're facing each other,
Yes.
and my knee is touching the parent or the guardian's knee,
Yes.
and the child's head is on my lap,
Yes.
as well as the child's legs are on the parent's lap. So that way it's easy for me to examine the child. So I have a grip and I can see, and the child has contact with the parent on the other side.
That's right,
So that's when we examine. So we make it comfortable. So they get used to the clinic, the ambience, the dentist, and we don't really do much. We examine. It's more about counseling with the parent, because that's what we call anticipatory guidance. So we guide them into what all can go wrong, how to teething is going to happen, and then brushing, how to start brushing, when to start brushing, what are the oral hygiene aids we can use to stop pacifier habits, to do breastfeeding. Also, people think that's completely safe. We'll be talking about that
Yes.
later, but how that also can cause cavities and caries, dental caries as we call it. So all of those things. So the age 1 visit is the golden rule. Come in at the age of 1. Get your child in so that we can, do anticipatory guidance and tell you what all to do in the future, so that we don't land up in that scenario where your children have to come in for more painful and
Yes.
more extensive dentistry. So that's how we examine young
Yes.
infants.
Young infants. And before the teeth come, also, is there any need for cleaning because they are either on breastfeeding or bottle feeding?
Yeah, so the habit can start. You have wipes, so take a damp cloth, wipe off we call them gum pads.
Okay.
So you wipe off any residual milk. So
Okay.
that's a habit that starts young. So then when they get used to it, when you actually have teeth, then you can do the same thing for the teeth when they're younger, till all their teeth come in. Or actually, you start brushing when the first tooth comes in.
Yes.
But gum pads also, you get wipes now, ready-made wipes
Okay.
to wipe off the milk residue,
residue.
because that can cause candidiasis and other issues in younger children.
Okay.
So if the milk residue is left over.
Okay. And bottle feeding and breastfeeding, like because people do not know baby bottle syndrome still, baby
Right.
bottle syndrome or nursing bottle caries. This kind of they're like, what is that? So would you want to tap into that
So
also?
that is the biggest problem that we face as pediatric dentists. And luckily, pediatricians are getting on board, and there's a call out for all the pediatricians. Please help us out with this, because they are the first connect. If they start enforcing that behavior with you know, with the parents, then that will change. So a bottle is anyway should be weaned off. Breastfeeding is great. It's recommended by WHO. It's a much better option than bottle feeding. Bottle feeding doesn't let the teeth or the jaws develop as well, because the flow of the milk from the bottle is anyway more.
Yes.
So, and it causes otitis and other problems. So even pediatricians are totally against now. They're calling it ditch the bottle. So if you can avoid the bottle, completely, if you can, because the bottle, because of the negative suction pressure,
Yeah.
it actually causes more ear issues also, and other issues. So if you can, after 6-8 months,
Yeah.
first of all, when the child shifts to solids,
Yeah.
it's not really essential,
Yes,
And we in India really believe that milk is mother's milk is different. It's providing the child with the musculature development is much better, because
Yes.
it's, breastfeeding.
Yes.
You have to use your muscles a lot more than with the bottle.
Yes.
Unless you use like, the physiological, nipples that are available.
Yes.
And breastfeeding gives them additional benefits of the immunity that the mother has.
Yes.
So that is not replaceable with the milk or the cow's milk and all. It doesn't do
Yes.
that. So the mother breastfeeding is great. Do it as long, but with some precautions.
Yes.
And bottle feeding is a big no-no, and bottle itself has other issues also, apart from dental caries, right? And because they lie down at night, when they're lying down, the milk pools around the teeth. That's when the child gets in teeth by about 1.5, 2. So when you're lying down, there's no saliva. Saliva goes down. The saliva. So there's nothing to clean the
Teeth.
oral cavity. So the milk pools, and that's when the cavity starts. So that's called early childhood caries now, is a broad umbrella term.
Yes.
And because of the bottle, so nursing bottle or baby bottle tooth decay.
Yes. So irrespective of bottle feeding and breastfeeding, even if it is breastfeeding, we still need to wipe the child's teeth
Yes,
after
absolutely. Yes. And breastfeeding, what we call is the current terminology is feeding at sleep time or feast. So it's not only the damaging part is not giving the milk. The damaging part is giving the milk ad libitum, as in when the child, just because you're used to giving it, especially at night when they're sleeping. Giving it as a regular time when the child is awake is fine, because the saliva is still there. The oral cavity is getting cleansed naturally. But if you do it at sleep time, just to put the child to sleep as a, like a dopamine or that kind of a release with the milk or the tryptophan in it.
Yes.
So, that's when it causes problems. So we call it feeding at sleep time or ad libitum breastfeeding. That's the issue.
Yeah.
So if you do it, wipe.
Yes.
And I know lots of parents, we have this conversation almost every day with every parent who's still breastfeeding. So I know it's tough. It's not easy to leave even the bottle, because kids scream and they're so used to it.
Yeah.
So the tips that I give is take a bottle. If you can, if you're on bottle, ideally you can stop, but don't give the bottle at all. But if you are, then add water to it. So if there's like full bottle of milk, start off with 1/3 milk. 2/3 milk, 1/3 water. Slowly make it half milk, half water. Then slowly make it complete water. The bottle is not as damaging as the milk inside it to cause cavities. So shift to complete water slowly over a gradual, about a week, 10 days. That's one way. Or then just go cold turkey. Stop 3 days, they'll cry. Habit changes after that. I know it's easier said than done, but And if you still can't do anything, the worst case scenario, I know it's usually at 3 o'clock, 4 o'clock in the morning when this happens, when the child wakes up to, demand milk or whatever, and they're used to it, keep a bottle of water next to you. So once they have the milk, then let them take a sip of water. So at least whatever little bit milk gets cleansed a bit.
Yes. So I've also personally struggled with this, and you had given me these tips and tricks to do, and I did not use the bottle myself, but yes, I was nursing for the longest time, and I did keep a bottle of water next to me and tried to wipe as much, because Ibhan was also, like, my son was also not such a great sleeper. But at that point of time, I remember a lot of pressure that I felt from the society at large that, if it's such a struggle, why don't you just give a pacifier?
Yeah.
And I did not give the pacifier after speaking with you.
Right.
So I also want you to talk about little about the pacifiers and why if they need to use it or they shouldn't use it. What is the
So pacifiers at the younger, when the kids are younger, initially it's okay, but they should not be honey dipped or with some kind of content in it. Because earlier when we were younger, when we were kids, probably when I was a kid, so that time you used to get these honey dipped pacifiers, which are then the honey itself becomes sugar, and then that's an issue. And honey anyway is a separate topic. So pacifiers then after once the teeth come in, then they start to damage the entire thing because of sucking pressure. Your jaws collapse and your front teeth come in front. So that can't be reversed then. So pacifier use is okay till about 6 to 8 months or maybe a year. After that, it should be weaned off. Pacifiers, initially it's supposed to prevent something called SIDS or sudden infant death syndrome. So because of sucking, that actually prevents that. So it's useful there. So I won't say they're completely bad pacifiers. But once the teeth come in, they have no place. So start weaning them when a child's teeth come in about 1. So start weaning off the pacifier by then. It has no place after that.
Yeah, because even with pacifiers, I have seen that the child is so comfortable with the pacifier that I've seen parents struggling to get the pacifier out, and child's
exactly.
big, like 4 years old, and the pacifier is still there. So that is
That becomes
an
another
issue.
challenge.
That
Yeah,
is another
absolutely.
challenge.
So
Yeah.
start weaning it if you're using it. I won't say complete no when you're younger. It has benefits, but once they're older, once the teeth are coming in, it damages. It has more damage than good.
Yeah. And after we moved from early childhood and we reached like the toddler age, a lot of patients and mothers and parents at large ask that, is a manual brush better or a rotary brush better?
Right.
Because the one of the friend has got a rotary brush and they want another rotary brush. So what do you
Right.
recommend?
So as far as the parent is brushing, that we'll be touching on that later. When is the right time to brush or not brush? I mean, when should they brush on their own? Give the brush as early as possible. It's not an issue as far as it's for fun. So they get used to it, make it like a family activity. But rotary versus thing, rotary brushes are equally good. Manual is fine. Rotary, what I have noticed, I mean, of now, is because of when they come in for dental treatment or whenever, if they ever need dental treatment that requires a rotary kind of sensation, the rotary brush actually desensitizes them. Because it gives them a similar sensation of what we do in the mouth. So even if you're not using a rotary, you should probably get a rotary brush if they're coming for some dental treatment. So at home, when they get those vibrations through the brush, suddenly our handpiece doesn't feel very different. Our rotary handpiece is a very similar kind of vibration and rotation for the brushing. So that actually desensitizes them to get dental treatment done easier. So if you're not, use it for that before they come into the dental treatment at least. Otherwise, efficacy wise, it's a big debate. It's just that it makes it more fun for kids. So recently I got my hands on this AR brush now. So they have these augmented reality brushes. I know screen time is another huge topic and issue. But so they actually have an app that connects to the phone. I mean your brush, and then whenever you move it, it actually moves the screen, actually kills the germs and all that, and you get levels and incentives and all of that. So that they've reached that level of kind of motivating. Then you have timers or play some music. I know brushing is another huge struggle with parents. It's something
and
I hear
sing
every
while
day.
brushing.
Yeah.
And all of that. Yeah.
Make it a family activity
Yeah.
is probably the best way.
Yeah. And recommended use of brushing is 3 minutes?
2 minutes.
2 minutes,
2 minutes, 2 minutes twice a day.
2 minutes
2 into
twice
2,
a day.
yeah.
Yes, and fluoride or non-fluoride, that's a big topic which everyone
That
wanted
is
to know.
it's burning. It's a burning issue. We've just been discussing it on our pediatric group as we were discussing earlier. So the thing is that it's a little bit of a myth. Fluoride is the only known substance till now that actually prevents cavities. It's been time tested. It's been there forever. Quantity is very important. So we'll touch on that when we go further. But the whole issue of fluoride is that people think that it's because of all this negative propaganda. So they're saying fluoride free. The whole concept is that you're basing that on the fact that you're going to eat the fluoride. We're not telling you fluoride is not a supplement. We're not telling you to eat it. Supplements are almost banned in the US now. In India, we've never given them, which is like orally taken fluoride as an systemic absorption or for your, to eat. Here we're telling it to use locally in the mouth. So it has nothing to do with eating. So the fluoride quantity that we're using is very well balanced for them not to get any kind of side effects with it. And the issues that these companies, most people are talking about with fluoridated toothpaste is that there's so much fluoride in the water already. So, that's causing all of this issue. So why give more fluoride when there's already extra fluoride in 300 some plus districts of India? But we're not telling you to eat it. That water, that's an issue with the water itself.
Yes.
It's not an issue with the toothpaste.
Yes.
And so there you need to control the fluoride in the irrespective of which toothpaste you give. They'll still get fluorosis or systemic fluorosis. What the issue is,
Yes.
it has nothing to do with that little 1000
Fluoride.
ppm of fluoride in the toothpaste.
Mostly the toothpaste that we have in India, which are easily available, only have 500 ppm
Yeah, but
anyways.
there are a couple of them now because the American Academy actually of Pediatric Dentistry actually recommends 1000 ppm toothpaste.
Yes, they do. Yes.
For children. So you have a couple of brands that are making it
Yes.
now because that's got the maximum efficacy for 2 times. We'll talk about the quantities and all. I mean later, I think. So the other issue is that in urban households where we all live in Delhi and all of our metros and most places, the RO water is completely fluoride free. Because the RO takes out all the fluoride. So then you're actually having no benefit of water fluoridation also. Like the US is controlled water. So they give that much water. Everything is balanced to, the water comes through the government. So it's adjusted. Extra fluoride is taken out, more fluoride is put in and the optimal amount is done. But here we don't have any such system in India.
So
and
we
the
do
RO takes out
require-
all the fluoride. So you're getting no benefit. That's why cavities are going on rising. I see early childhood caries increase so much because of that lack of fluoride. So at least we get augmented with the toothpaste.
And also with fluoride toothpaste or non-fluoride toothpaste or even a manual or a rotary brush, I feel that we need to emphasize a lot on the brushing technique.
Absolutely.
Because no matter what the best of the stuff that you have, if you're not brushing well, then it's not
it's of
going to
no
work.
use, yeah.
So there are brushing techniques which are different for adults and teenagers and of young patients. So we would be showing that also.
We'll demonstrate that. Actually, to simplify things, a lot of parents ask me, what is this cavities? What are these dental cavities? So in a very simple layman language, we have bacteria in the mouth, which are normally there. Okay, which if we don't clean properly, the bad ones take over, which is basically Streptococcus mutans. So they are there. Then you have the tooth itself, which is made of calcium or hydroxyapatite. So when those two combine and you eat sugar, which is the food, so it's basically the tooth, which is calcium, combined with the sugar. When the sugar is attacked by the bacteria, it produces acid. So now our tooth is made of calcium. So the acid dissolves the calcium, which is essentially what caries is. Cavities is what we prepare as dentists because we do that with our, with our machine, our air rotor. So that's a cavity. So what you actually get is a disease which is called dental caries. It's not called a cavity, which is what lay people call it. So it's actually caries. The disease is called dental caries, which is essentially the sugar broken down by the bacteria, which then produces acid, and that acid dissolves the tooth. That's simply what. So we have to attack it at each level. Reduce sugar. That's the first step. Brush well so you have less bacteria in the mouth, less plaque. So if you catch those two things, that takes care of two parts of the spectrum. And the third is the tooth. To make the tooth stronger, we give fluoride. So these three things are taken care of by making the tooth stronger with fluoride, reducing the bacteria by brushing well, and reducing the sugar intake. So then it's a totally preventable disease.
Also the frequency of sugar. I feel that if a child is having like sugar 4 times, just assuming. So if the child is having in the morning, afternoon, evening and night, the chances of caries is much higher than if he's having or she's having the same quantity in one go. Is that
absolutely true? And it's all about the acidity level. As I said, acid. So if you eat it with food, your regular food, the sugar is given with it, so the acidity balances out. The pH, as we call it, it balances out. So then the cavities reduce. So we always suggest eat sugar. Or eat like our Indian system has always been there. Eat your sugar or your meetha after the food. So that way it takes care of the acidity. So it's been going on for ages. They already knew, I think, what we didn't know, our ancestors. So they always said you eat your sugar eat your meetha straight after food. So then the sugar doesn't produce that much acid. And always rinse after every meal. So that takes care of a lot. Even today, if all children just rinse, which also they don't do because they're running to the, somewhere or the other. They're so busy nowadays, some tuition class or some sports or something. So they don't even get time to rinse them out after eating. Just a simple rinsing helps. And all these sour bombs and all your Oreos and anything that sticks around for too long without mechanically being needed to be removed will cause cavity. So those are the real culprits. A silk chocolate or an ice cream is less harmful because it dissolves really fast and gets out. Because it doesn't really stick to the teeth. So that's the key. It's also the kind of food you eat. And for snacks, why give all these meetha things? Biscuits are not, it's so typical to give biscuits that you're going, but better than that, give like cheese or nuts or, crackers or something that's not or a fruit.
Makhanas.
Makhanas,
Yeah.
exactly. So you've been,
Yeah.
you probably have that struggle more than I
Yeah,
do.
struggle. Yeah, the struggle is real.
Yeah.
Yes, that's true. But I also do recommend like I do consult with certain kids that if they can just have if they can't, if they don't have time to rinse them out, then they can just take a sip of water from their bottle
Absolutely.
and
Even
just
that,
move it around and just take it inside
great
rather
tip. Yeah,
than,
that's
yeah.
excellent. Yeah.
Yeah, because at least if they can't go to the bathroom, even, and I say that to even my adult patients,
Yeah.
that we are stuck in a meeting and you can't go,
Yeah.
and you've just had a bite, just take a sip of water and just take it in. It's definitely going to be better than not doing anything at all.
Absolutely, absolutely.
Yeah.
So Ishita, how did you take care of healthy snacking for Ivan? I'm sure it would have been a challenge.
Yeah.
As a dentist mom yourself.
Yeah, yeah, that's actually quite a challenge because initially it was easier, like in the beginning 2 years, because I was very both me and my husband were very strict regarding sugar intake. After he turned 2, things started becoming a little like off the radar, but still I tried as much as I can try to put healthy snacking in. I've put cheese instead of mostly like refined sugar
Right,
chips.
right.
Completely avoid chips, and I've put makhanas, popcorn, juices as low as it can't be. We have to be realistic. It can't completely be. I'm not the only
Absolutely, yeah.
person, because of the availability in the market regarding juices,
Right.
and cold drinks is a complete no still. I don't think I'm ready to start putting that poison inside him. Juices is still challenging, but I have tried to put more healthier options like milkshakes, which we
Right.
make at home rather than what come in the market.
Right.
Coconut water. Yakult also has a lot of sugar,
Right.
but
Yeah,
it's
that people
still,
don't know about,
yeah,
yeah.
still it's healthier than like an orange
Because of its
juice, like
probiotics, yeah.
a orange juice or any watermelon juice which is made at home is obviously much better than what is available in the
Right.
market. The toffees and all. It's best not to keep it at home only, because if it is seen, it is going to be consumed when I am in the clinic, or there's going to be a struggle when I reach home that I want to eat this. So it's better just not, just keep it out of sight. Chocolates, I still am okay, but I titrate the amount of chocolate that he gives. I always make sure that he rinses his mouth. If he can't rinse, the same thing that I spoke about, like just making sure that he takes a sip of water afterwards. And I have focused a lot on brushing. And I am, touchwood, very lucky that he is also very tolerant to brushing, because I started brushing his tooth when his first tooth came out.
Great.
And his first tooth came out when he was almost a year old. So ever since that, it is just a routine that he has to brush twice. And I have used fluoride toothpaste ever since the beginning.
Excellent.
So, and I keep, obviously you check him, and I constantly check him at home that there are no cavities and everything. And he himself also checks himself,
Yeah.
that like I'll open my mouth. Do
I
you
know.
think
He keeps coming, so I keep seeing him in the clinic.
Yeah,
So,
yeah.
in aesthetics, everybody's there. So
Yeah.
he always comes, opens his mouth, lies down on a
Yeah.
chair, and looks up at the TV, and he's like,
Yeah, yeah.
like Dr. Nikhil Balloon and his
Yes.
Spider-Man tattoos.
Yes.
So,
Yes. And also, one more thing which I just started doing was that whenever I was struggling with something like a refined biscuit, for example,
Right.
an Oreo biscuit, he wants to eat that, and he's eaten it. I always tell him that, look, it's stuck onto your teeth,
Yeah.
and I can click a picture and show it to you.
Yeah.
And then it was the new thing, because every time he ate something which
He
he
wanted to-
knew, he said, "Can you click a picture for me?"
Sure.
And then I clicked it and I zoomed it and I showed
showed
it to
him.
him,
Great,
and he
that's a
was
good
like,
tip,
"Oh,
yeah.
this is not good for my teeth." And then he used to go and he used to brush
Brush
it
it.
off. And then he used to say, "Now you click another picture and show it to me." So all that sticky stuff was
Yeah,
not
which exactly you're
was
talking
not
about.
there. So I know that I might not be 100 on the
Nobody
kind
can
of
be.
sugar or refined food that he's consuming, but I can definitely give myself 100 on his brushing, because I have had, sometimes with these you feel like, my husband's like, he's tired. You can
Right.
like relax it today. And I'm like, no, he has to brush his teeth. There is the no
No,
for
no,
that.
no,
So I can
non-negotiable.
Yeah,
So
non-negotiable.
actually, the thing is that currently they're saying that the current guidelines, not only dental, they actually say no sugar at all for children less than 2.
Yeah.
The current,
Yeah.
even the
Yeah.
Heart Association
Yes.
says no sugar at all for less than
Yeah.
2, and about 5 teaspoons is all that's allowed
Oh, yeah.
for any child older than 2.
Yeah.
And what I give a tip to most parents is that, make a cheat day.
Yeah.
Once a week, decide, let them go all out.
Yeah.
So, just like we do for,
Yeah.
fitness or whatever.
Yes.
So just make a cheat day and fix a day in the week where they can eat, like on a Saturday or whichever.
Yeah.
And if they do in between, then they should brush. So sometimes the kids, they don't like brushing, that kind of dissuades them from eating
Yeah.
those sticky snacks also.
Yeah, yeah. And I also feel that parents do not know how much toothpaste to put onto the toothbrush,
right.
whichever fluoride or non-fluoride. Because ever since we were growing up, in advertisements, they used to
Yeah.
always put like that whole line of toothpaste.
yeah.
So everyone just assumes. And the nannies also, they have also, like,
Yeah.
obviously they are also, we should give it, they're not that educated.
Right.
So they will always go with that commercial marketing.
Yeah.
So it's very important to know that for like 0 to 2, we give a rice grain,
Rice grain or smear, yeah.
rice grain amount, just rice grain. And then from 3 years to 6 years, we give a pea size of toothpaste.
Matar
And
ke
then-
dana.
Matar ke
Yeah.
dana. And 6 years onwards is when we can give
1 to
a
1.5 centimeters is what we
1 to 1
recommend,
point recommend. And also,
But all fluoridated. Because all these, some brands are available which are non-fluoridated. We suggest, the current guideline says you should use fluoridated from day one. No, none of that non-fluoridated. But the quantity, as you highlighted, is very critical.
and also, parents are like, वो तो brush नहीं करता हमारा बच्चा, वो जो करता है वो हम उसको करने देते हैं. But that is not good, because till 6 years of age, the child does not know how to brush.
Exactly.
So it is very important that there is someone who's brushing for the child.
them.
So even if sometimes my son says that, I want to brush on my own, so I give that to him. I'm like, you brush it,
Right.
but I will check it. And if there is a spot which is not
Leftover,
left over, I will correct it, which is done. So till and parents are like, then how will we know that the child can start brushing? So what I tell them is that till the time the child does not know how to tie their own
Absolutely.
shoelaces,
Yeah.
till that time you need to brush
Yeah.
for
Tie
the
the
kid.
shoelaces or break a roti. That's what we usually tell the parents,
Okay.
If you can't tie your laces, or if you can tell your child cannot break his own roti and eat,
Yeah.
they don't have the dexterity to actually do the
Brush
complex
it.
brushing, the technique, right technique.
And for flossing or for using mouthwashes, what do you recommend?
So flossing, once the two teeth come in contact, that's when we recommend flossing, because once the teeth come in contact, you need to clean in between. Fluoride does take care of some of it, interproximal caries as we call it.
Yeah.
But yeah, you need to floss. So we have nowadays there are very nice flosses available for kids, which like flavored, and they have like animated characters on it. Mouth rinse is only for high caries
High
risk,
caries
or kids who are doing braces or orthodontics where there's higher chances of getting cavities.
Got it.
So it's not for everybody, and especially if you can't spit. So definitely it's above 6 years plus.
Okay.
If you can't spit, no mouth risk, because then they'll definitely swallow it.
Yes.
So mouth rinsing
that's-
is for that,
yeah,
for older.
for older
And if you're
kids.
keeping it, make sure you keep it away, because there have been instances where children have swallowed the mouth rinse,
mouthwash.
because it look colorful and nice.
Yeah.
So for younger kids around, keep it away. Even if you're old, if you have 2 kids, the older one is using it, just keep it away. So mouth rinsing only for selected cases, selected scenarios.
Okay.
Otherwise, most of this basic stuff works. But doing that only becomes so challenging.
Yeah. We also do a lot of fluoride, like topical fluoride applications in our clinic.
Right.
Which we do twice, once in every 6 months.
Right.
So, do you recommend that for all children, or do you recommend that for specific?
So the reductions, we are talking about fluoride varnish, and thanks to you, we got the hands on all the flavored ones now.
Flavored
The kids are
varnishes,
loving
yes.
them. From
Even the adults are loving
Yeah.
them. They're like, oh, we will have the pina colada, we'll have the cherry one.
So yeah, so
Okay.
because of that now,
Yeah.
because earlier kids didn't like the taste of that
Yes,
fluoride varnish
yes,
at all, which is, even though fluoride varnish is probably almost 40 to 50% reduction in cavities have done biannually,
Yes.
twice a year. So the flavored ones, which thanks to you, we got our hands on. I suggested. And
Yes, you
made
the
it
one who-
happen.
yeah.
So now when I open that box and they're like cola, lime, pina colada, cherry, they're like
Yeah.
they're really happy. And bubble gum, that's the
Yeah,
favorite right
bubble
now.
gum is the
Yeah.
favorite, yes.
So yes, so that good, apart from the the taste and everything, which is
Yeah.
patient acceptability is a huge
Yeah.
issue.
Yeah.
So that's become a breeze, because now they
Yes.
come every 6 months, they've chosen their flavor, they
Yes.
come and get it done.
Yes.
So that's made life easy, and fluoride that really helps.
Yeah.
But as you said, good point. So only high risk children it's beneficial for. If you don't have any cavities as such and the parents are following all these protocols,
Yes.
so we usually start off with a questionnaire asking about, as you said, if the parents are having challenging time brushing and all of that, definitely get them in.
Yes.
If you can't do it at home, we'll do it at least biannually and
Yes.
reduce cavities,
Yes.
the fluoride application, because it has a benefit. So unfortunately, most parents have that issue nowadays of being able to brush.
Yeah.
So it's better to just come in, we'll do a risk assessment.
Yes.
Because if the cavities or anything starts, they initially start off just as a white spot.